Hello, my name is Екатерина. I'm a student of the Saratov State Medical University of the first years of the Faculty of Dentistry.
Hello, my name is Victoria. I'm a student of the Saratov State Medical University of the first year of the Faculty of Dentistry. Now we will talk about regenerative dentistry. Modern scientific discoveries have facilitated the development of regenerative dentistry. The most realistic goal for this area of dentin in the coming years is regeneration of some dental tissues, such as the palm or dentin.
Regenerative endodontics is a biologically based procedure designed to replace damaged pulp and dentin structure. Historically, dentistry has been based on two different scientific platforms, one of which is related to development of modern physics, chemistry, material science, and other medical technical disciplines. This sector of dental development is defined as technocratic. At the same time, in parallel with the technocratic approach, there are biological technologies based on the possibility of stimulating regenerative processes in the tissue of the maxillofacial region. The biological vector of development relies on the achievements of fundamental medicine, cell biology, genetics, tissue and cell transplantology. The first studies on the regeneration of tooth pulp date back on the 1960s. Then Osby conducted clinical studies, during which he caused bleeding in the root canal and noticed the blood clot was gradually being replaced by granulation tissue and fibrous connective tissue. The first clinical of regenerative endodontic therapy was published in 2001.
Modern scientific research. Over the past 3 decades, the All-Russian Center for Eye and Plastic Surgery has been focused on the problem of regenerative dentistry, using alloplant transplant materials for this purpose. The works of Gofullin, Sternberg, Musina, Babina are also devoted to the introduction into clinical practice of various alloplant series. The aim of investigation was to study dentin regeneration. The scientists use a biological layer for pulpitis treatment as a material for regeneration. The experimental including 16 dogs, 40 teeth, of which had chronic traumatic pulpitis and deep traumatic caries. In experimental group, a biological layer for pulpitis treatment was used. Results of experimental investigation showed the biological layer promotes formation of regenerate on the side of dentin alloplant in the biomaterial. Regenerate form on the side of dentin alloplants is characterized by early mineralization, formation of dentin tubules, and intimate joining with primary contact dentin. Studies of histological preparations have revealed vectors of dentinogenesis. The vector of tertiary dentin formation is oriented towards the tooth cavity. The other vectors forms a regenerate in place of the dentin alloplant, which is a biological composite. The formation of a regenerate at the side of the dentin alloplant was revealed on the 75th day of the experiment. Thus, this work proves the fundamental possibility of reparative dentinogenesis in the transplantation of special forms of biomaterials.
Technocratic and regenerative approach in dentistry, being at first glance antagonists, actively complements each other. In that way, regenerative dentistry is a transition from treatment-based on the use of some specific material and treatment-based of the biological principles.